Hello, this is Elizabeth Clare Brewington with Discover Brightside, and I am here to talk about something that's very near and dear to my heart is are you keeping good records? And especially in a time when we've seen fires and hurricanes and pandemics, and I think our generation is witnessing a lot of things. So if you're not keeping good records, then you need to pay attention to this very special broadcast. So I'd want to begin with Evelyn. Evelyn and Sean, please introduce yourself. And then I heard that Haasini has a beautiful story to tell us as well. So over to you. Tell us more about Vaccine Genie.
Hi, everyone. Thank you so much for having us on. It's a pleasure. So I'm a family physician. Been working in the U.S. and also abroad for over 20 years. So I'm an immigrant. I'm a first generation immigrant. My family, I was born in Taiwan, and then my family brought us here when I was in elementary school. And I remember vividly getting lots of vaccines because my parents didn't bring, they brought duvets and they brought stuff that they heard were expensive here, but they did not bring my vaccine record. So I remember getting a lot of shots when I first came because it was like, oh, she has to get all these shots to get into school. That was like a mini trauma. But more importantly, after I became a family physician, working here and also in China for on and off for 10 years. I've worked in New Jersey, New York, Alaska, Canada. I'm not Canada, California, and Washington State, where I am now. Um, and no matter where I went, whether people move internationally or domestically, they don't have their records with them, right? They feel, especially after we became digitized, people thought that we were all linked. Um, and I was like, no, it's not. And even adding more to the confusion is that the US um, hospital systems are dominated by two major, as I would say, commercial, so not like not the military, not the veterans, but commercial electronic health records is dominated by about three companies, the largest of which is Epic. And they call their patient portal, which they're required by law to have so patients can access their records, they call it My Chart. And so people will be very confused and they'll be like, well, but you have my chart. And I was like, yes, but that's like Gmail, right? It's not, your one Gmail doesn't know what your other Gmail. I mean, they're two different inboxes. Now, if you want to sync them and have them move from one to another, that's a separate issue. But it's otherwise they're different things, right? It's like a Google Drive, it's like your Outlook Drive. They're all completely separate and segregated as a feature, right? To for privacy reasons, so people can segregate. But as a healthcare provider or as a mom, I have two teenagers now. Segregation sounds good for privacy, but when you're trying to figure out who had what vaccines, who was sick from what, who had what reaction to what, you have to keep those records yourself. And it's very difficult when you're moving from place to place. And this is something that's important for your family's health. Um, but it's very hard to keep track of without additional assistance. And we have the technology to assist that, and that's where Vaccine Genie comes in. So Vaccine Genie is leaning on the current AI revolution to provide AI assisted what we call optical character recognition. It's a simple word of saying you point at something and then it reads what it is on the page for you. So you take a picture of it, we read all the words for you, we recognize it, and we pull the vaccine information from there. And recognizing that traditional vaccine records are usually printed initially, and then if you're from most places, then in additional, there's a handwritten feature, which may or may not be very clear. We also allow customers to edit as they need to and be able to, more importantly, keep the original data, right? So if somebody needed to go back and vet it, we have the original picture of what the vaccine record looks like. So we can say, oh, well, was that correct? Did the OCR do it correctly? Did you do it correctly? So you have a way of going back and looking at which COVID vaccine was the one that I got, chest pains with, which flu vaccine was that. And so that you have a good um, um, legacy and records of what happened. And not just for you. And I think this is especially important for mothers. We want to know, we understand that family is linked, right? It's very common for if a mom has or a parent has penicillin allergy, for example, for the child then to have a higher chance of having penicillin allergy. It's not 100%, but it's there. It's same true for us, as far as we know, for vaccines. Well, I'll have whole families say, me and my brother, we both get really, really bad fevers when we get this vaccine, but with this other vaccine, we do not. And some people are able to keep a record of that, but other people aren't. And that then I was looking at your podcast with Dr. Kaplan, where he was talking about genomics and how, we have all this information, but if you don't actually get the phenotype, right, how people express. So just because somebody is theoretically gluten intolerant doesn't necessarily mean they are, right? You have to get the history. And that's what we're missing right now. We're in the age of a lot of data, but not a lot of ways of making sense of what data is important. And that's where Vaccine Genie comes in. We're going to help you manage your data from the vaccine point of view. It's not just a matter of which vaccine you should have for school and work, and that's important. You want to be able to start work and school on time. That's that's the survival. That's survival 101. But beyond that, you want to be able to keep track of it so that if there's additional vaccines, that you'll get a reminder and say, hey, look, now there's this other vaccine. Or hey, now in the Carolinas, actually both North and South Carolina, you guys have an outbreak of measles, right? Is your measles up to date? Washington State recently just got our first measles case that we haven't had. The last measles case we had was, I think, maybe 8 years ago, which then sparked the legislature to require measles vaccine, um, uh, and not allowing personal preference as an exemption. Um, only allowing like a medical physician, like two physicians, to sign a letter to say that you can be exempt from it, because there are people who have to be exempt from it for health reasons. Um, and so after that legislations, we have not had a measles case until this case was brought over from South Carolina for a person that was visiting somebody in Spokane. And so that's a big deal. That's a big deal for patients who are, who have bone marrow transplants, people who are on chemotherapy. And, we can't tell them that who those people are when we're in the supermarket or we're going to school, right? um my eighth grader class had recently had a classmate, so an eighth grader, so it's heartbreaking, who died of leukemia, right? But she's actually battled with it for years. And it's different because you don't know, like, people look healthy, right? They're showing up for band, they're showing up for that, but that kid probably could not tolerate a live vaccine like measles. And so when we do vaccinations, not only to protect us, but protect those around us, right? Those we can see and those we cannot see. Those we can see are struggling with their health, and those who we cannot see. So I think it's really a matter of kind of showing compassion to our fellow human beings, as well as to our family. And that's why Vaccine Genie matters. And at right now, a basement introductory price of $10 a year. $10 a year. That's like one large latte at Starbucks. um, or one boba tea if you're here in the Seattle area and you add additional pearls. um, yeah, we have expensive boba tea here. Um, so just, we want people to have the tools to be able to manage their health, starting with prevention, right? Prevention is always the way to go. You much prefer never having a disease than having to deal with the aftermath. So that's why Vaccine Genie was born, and we're very happy to be on this podcast. Thank you so much for having us, and for us to get the word out about how we can help take care of each other, one vaccine record at a time.
Oh my God, that is just amazing. I love the work that you're doing. And yes, Dr. Kaplan is a big part of our community. So It is all about taking care of your health. And I can completely relate because I grew up in India and we had so many vaccinations, and I don't have any records of them. And so now that we're in the pandemic and we're taking the first question people ask you, were you vaccinated for chickenpox or measles? And you're like, I don't remember, you know. And so, though that is very important information that could help you in the future for things that are going on with you. So over to you, Sean. Earlier in the studio, you were explaining to me how Vaccine Genie works. So how does someone enroll? What do they have to do? What's going on? Tell us all
Well,
about it.
Vaccine Genie is actually really simple. You basically can just take a photo of your records, it will import them and automatically translates, saves them to the system, and you can take that information and export them as PDF to legal forms for school, work, or travel. And it's as simple as managing your family photos. And I came
I would
aboard,
say it's easier because I was always having a hard time figuring out
well,
which one to delete. I delete this one? Maybe I want 10 pictures of them standing next to a pumpkin.
yeah, I came aboard. I'm recovering from a heart attack, well, a stroke in 2012 and a heart attack in 2014. So, I mean, I spent enough time in the back of ambulances and in ERs to know that having your records on, at hand is just so incredibly important that vaccine records when you're going to travel, when you're trying to enroll in school, if you don't have them, I mean, the delays it can cause, the problems that can arise are incredible. And like Evelyn mentioned, well, I can't remember if she mentioned it or not, but we have about 70% of our staff right now are first generation immigrants. And most of them have reported having some kind of issue with their vaccine records, causing some delays. We've had several that have had to get all of their shots redone when they
Ouch.
came into the country. So it's just amazing the number of issues that can arise from vaccine record problems.
Yes, I totally agree. And as Dr. Evelyn was talking about, knowing, being informed about like what is it that what side effects do you have, and just knowing, the reactions you had to a vaccine helps you with taking future vaccines. And so that is very important. Now, Hasini, we heard that you have an amazing story about why you wanted to work for Vaccine Genie. So tell us about that.
Yeah, I shadowed a doctor in a hospital in India, and it was a major city. And I noticed that while we were going around to different patients, all of the records were on paper, and all of the patients were carrying like little inpatient and outpatient books. And I asked the doctor about that, and he said all of their records are on paper, and the patients have to remember to bring their book for every appointment or scheduling any kind of like um, kind of doctor's appointments. And it's just so, it was so shocking to me because we live in like such a world that's such digitalized, and that it's a major city which has a lot of technological advancements. But this major cancer hospital, like for long-term patients, they were still somewhat lacking in a way of making healthcare accessible. And that's honestly, that experience is why I wanted to join Vaccine Genie, and also why I chose to pursue public health in college to focus on health empowerment and accessibility to underserved communities.
You know, that's a great story. I mean, when you think that we're living in war times, I mean, people never thought that we'd see so many wars. And then developing countries have always been challenged with keeping records. That's been number one. And paper can get lost. I mean, you can have a fire, a hurricane, anything can happen. So I really applaud you all. Now, what came about Vaccine Genie? How did you all decide that this was an important thing that you'll want to get behind?
That's yeah, that's our origin story, as Sean calls it. As a family doctor, I would have people show up and in primary care where we're trying to update people's vaccine and they'll be like, well, they got all of them. And I was like, well, I don't know what all of them are, right? Because different countries have different ones. Also, after having, finished residency in the US, as I said, I went and worked abroad. I worked in China on and off for 10 years. And I later found out that they are very much the norm for third world countries. They're kind of like a in between third and first world, which is that because of their high number of measles, just as one example, they give the first measles vaccine at 8 months old, and gives only one MMR, measles, mumps, and rubella, at about 18 months, because of their endemically high numbers. What that means is when they come to the US, that first measles doesn't count because it's not as immunogenic. It doesn't give you a lifelong um, immunity. And so if you didn't know that and you just saw on your, graduate school that they wanted two and you counted, you did your math, 1, 2, 1, 2, you come over here and then suddenly, they're like, oh, you can't start until you get a second one. And here you're in a new country and the US is the combination of the highest regulated and the least um, uh, well, health easy, accessible uh, medical system there is, right? And it's expensive. So that's a lot to navigate for an international student, or parents who are just trying to get their kids in school. Um, so I've seen many records that are incomplete. So if they happen to be in Chinese, I've seen them translated incorrectly. Um, and it makes a difference, right? Because you're spending on our end, you get a 20-minute appointment. 5 minutes is with the MA, just just trying to catch up on whatever stuff you brought in. When you show me the stuff, I can't, I'm not going to be able to do this for you. There's just no way, right? And so that just the healthcare system is already very stressed. This is one way where we can unstress that and in a way that's meaningful, right? You do it once, and if you go to a different place, you have it there already, right? It's not like you're having to redo it every single time you go to a new place, right? And every time you have something new, we just keep adding to it, adding to it. Um, and if they come out with a new vaccine, we'll kind of remind you as well. Many people don't realize that physicians are so busy that we only deal with what the government will pay us for, right? I mean, that sounds bad, but for example, um, it's one of the common indicators of good or bad primary care. Did you get your flu vaccines for this year, right? So many of us will get reminders from our healthcare providers, but or age related, like did you get your shingles shots and pneumonia? What many people don't realize is that as soon as you're diagnosed with a chronic disease, which are many, including diabetes, the age of onset for diabetes is getting younger and younger. You're supposed to get your pneumonia vaccine. Most people don't have that because it just doesn't get added on digitally, because otherwise there'll be like alerts all the time and we'll get alert fatigue, right? And so patients in currently are the only ones in the healthcare arena that actually have the time and the personal knowledge to say, I had pre-diabetes. Should I get this now? Or to actually ask those questions. And most patients do. They actually do care and they want to do well. Um, and having and tapping to that partnership means we give them something, we empower them with a way of keeping their own records so that they can communicate to us on the same level.
I'm so glad you talked about that, because coming back to the US, because anyone in a developing country knows what a vaccination is, but many in the US have no clue about vaccinations. And I think it was only because of the pandemic, or, someone went overseas to a developing country. It's probably they had a malaria shot. That was probably the only one they had. But I think the vaccination topic has emerged now because. So, what do you think with the
By the
current?
way, there's no malaria shot. There's malaria pills, but not a shot. So
Okay,
there's yellow fever shot. Maybe that's what you're thinking.
maybe
Yeah, just
you
FYI,
would
there's like
probably
no
know better than me.
shot.
Yeah, but still, the very
Yes.
fact that Americans are clueless when it comes to vaccinations. And so I think the phobia, with vaccinations and not to do it, no, no. What do you think about the current administration? Because there's been a lot of debate about whether or not, let me ask Sean this question, whether or not we should be vaccinated. So what do you think about, why should people get vaccinated?
Well, without getting too political, I disagree with not getting vaccinated. I At 2 years old, my parents decided it would be a good idea to take me to a chickenpox party, and one of the kids there had the measles. So I had chickenpox and the measles and spent about 2 months in the hospital and nearly died. So I really think everybody should be vaccinated for everything. Vaccinations save lives. There's no questioning the science.
Yeah, I
I
totally
just
agree.
I'm in urgent care now, and
Yeah.
oh sorry, I'm in urgent care now, and just last week we had a adorable kid that came in with a cough that wouldn't go away. She was unvaccinated. Her test came back a few days later, because it doesn't come back right away, that she had whooping cough. And we get really sick patients. I mean, she was in the lobby with transplant patients, with lung, people with very advanced lung and heart disease. Now we have to track them all down and get them on antibiotics. Some of them have had antibiotic allergies, right? So then we have to look. And so this is not a benign thing not to be vaccinated. You're really, but not to. We're not here to change people's view of vaccination. I feel like our goal is for those who feel that vaccination is for them to be able to keep track of it. And so that if they have a fever with a rash, they can look back and said, my measles up to date, right? I don't have to be sequestered, right? It's probably, it's probably something else. Right? That's the first thing we ask. Like, we sequester them and we kind of say, okay, what's your travel history? What's going on? But now that measles is endemic, travel history is kind of irrelevant now, right? And so, but if they are recently vaccinated, or they got vaccinated like they're supposed to, that makes a huge difference as our differential, right? Otherwise, we're doing all sorts of poking and prodding to figure out what they have. Yeah.
Yeah, it definitely, it saves time for diagnostics. It saves time for long-term
And time is life,
and time is
right?
like, yeah.
Yeah, time is life.
Well, on that note, I want to thank you all for this interview, and I want to tell my viewers that, don't be afraid of taking vaccinations, but as with everything, be informed, find information. But I think the best thing I've ever seen
Well,
is
talk to
vaccine.
your doctors,
Genie,
right?
talk
Find
to
out
your
what works for
doctor.
you. Yes.
Yes, talk to your doctors, but record keeping, because that's what the topic is today, is record keeping. And I think what y'all are doing with Vaccine Genie is enormous. I mean, so go get yourself, signed up and start keeping good records, and that could save a life. So thank you all for what you'll do, and we're going to have them back. We're doing Empower Black, Empower Women. These are very important months when it comes to healthcare. So we're very excited to have them on the show. So thank you for
I don't
watching.
know if you noticed, but we're both wearing red because this month, besides being Black History Month, is also American Heart Association's month for recognizing cardiovascular disease in women.
So that's
And the color
coincidence.
is red for that. And here's
Yes.
my here's my middle schooler who had the unfortunate classmate that had the
Cancer.
health. Yeah, she passed away. So yeah, it was very very heartbreaking. Yeah. So
Very
so
sorry to hear that. Yes, that is heartbreaking.
it is.
All
It
right.
is.
So thank you for watching and stay tuned. We're going to have more on vaccinations. I could talk about this topic all day and all night because it's a big
Thank
topic
Thank
you
you
for
for
me.
so
having us.
much.
Thank you.
And we'll see you all then. Bye bye.
Bye bye.